Hello dear learners, hope you all remember the phytochemistry and the effect of processing on fenugreek seeds that we have learned in the previous module. This module will enable learners to understand the use of fenugreek seeds as a functional food, its therapeutic formulation and fenugreek seed as an additive. Let's begin by understanding the properties of fenugreek seed as food stabilizer, food adhesive and food emulsifier. The interaction of fenugreek protein with the food constituent determines its ability to stabilize and emulsify the food constituents. The emulsifying stability of soy protein isolates with fenugreek gum dispersion was 3 times higher. Emulsifying properties and solubility of soy protein isolates with fenugreek gum dispersion were also stable over a wide range of high temperature, pH and ionic strength. Fenugreek seed contains greater dietary fiber content which act as a probiotic in functional food. The soluble fiber of fenugreek act as an excellent substrate for fermentation done by microorganism in large intestine. The dietary fiber of fenugreek has probable use in the food industry because its galactoman composition has emulsifying and stabilizing properties. Flour supplemented with 8% and 10% of fenugreek dietary fiber has been used in the production of baked goods such as bread, pizza, muffins and cake. Learners, now we shall be learning about diosgenin. Diosgenin is a biologically active steroid sapogenin present in fenugreek. Diosgenin has been proposed to be effective against variety of pathologies including diabetes, hyperlipidemia, cancer, cardiovascular disease, oxidative stress and inflammation. Studies assessing diosgenin for a toxicity have shown that the compound is generally well tolerated orally in dose of up to approximately 500 mg per kg. In assessing potential of fenugreek as a therapeutic agent in combating diabetes, diosgenin has emerged as an important mediating factor in several of the biological effects of fenugreek that contribute to the maintenance of insulin signaling and glucose homeostasis. Let us now see structure and chemistry of diosgenin. Structurally, diosgenin is a spirostenol saponins. You can see the formula on the screen, consisting of hydrophilic sugar moiety linked to hydrophobic steroid erglycon. Diosgenin is structurally similar to cholesterol and other steroids. Since its discovery, diosgenin is the single main precursor in the manufacture of synthetic steroids in pharmaceutical industry. In recent study, it was shown that spirostenol compound, especially diosgenin glycosides, exhibited inducible or inhibitory activity in rat uterine contraction based on the number, length and the position of sugar side chains attached by glycoside and related to structure of erglycon. Structure of related function of diosgenin has been extensively tested using cancer cell in vitro. The biological activities of diosgenin and other structurally related steroid saponins and alkaloids were tested in vitro by using molecular modeling. The sapatial conformation and electron transfer capacity were calculated in relation to structural characteristic of diosgenin necessary to elicit its effect on proliferation rate, cell cycle distribution and apoptosis. The anti-cancer bioactivity of diosgenin was shown to be related to presence of hetero-sugar moiety and 5,6 double bond in its structure. Moreover, structural conformation at C5 and C25 carbon atom was shown to be important for diosgenin biological activity. Further studies were warranted to assess the structure-function relationship of diosgenin and understand whether how synthetic changes brought about augment its biological activity in favor of its role as a therapeutic agent. Let us now see the bioavailability of diosgenin. Rodent studies on the disposition of diosgenin revealed that diosgenin was poorly absorbed and underwent extreme biotransformation. In the same study, it was found that 1 micromole per ml of diosgenin was recovered from the serum of human subject receiving an oral dose of 3 gram of diosgenin per day for 4 weeks, suggesting poor absorption and possible active biotransformation. Learners, let's now find out the sources of diosgenin. Diosgenin is chiefly present in wild yam, legumes and fenugreek. Let us now study the health benefits. The lipid lowering potential of diosgenin has been demonstrated by several experimental studies. Diosgenin decreased elevated cholesterol in serum LDL and HDL fraction in cholesterol-fed rats and had no effect on normal serum cholesterol in normocholesteremic rats. In addition, diosgenin inhibited cholesterol absorption and suppressed its uptake in serum and liver and its accumulation in the liver. Diosgenin lowered plasma cholesterol in diet-induced hypercholesteremic rat, chicken and rabbits when administered orally or parenterally. Recently, it was shown that diosgenin at an oral dose of 0.1% to 0.5% in the diet for 6 weeks decreased total cholesterol level and increased plasma high density cholesterol levels in both plasma and liver of diet induced hypercholesteremic rats. Diosgenin and endurance. Diosgenin is a significant precursor for the production of number of sex hormones. Diosgenin, a steroidal sapogenin, is reported to augment overall weight and muscle growth in rats as seen in many studies. Moreover, diosgenin is reported to improve glucose metabolism by promoting adipocyte differentiation and inhibiting inflammation in adipose tissues. Muscle endurance mentions the ability of the muscles to achieve a continuous effort without fatigue. Cycling, step machines, sit-up tests are often used to measure muscle endurance. It has been reported in many in vitro and vivo studies that supplementation of fenugreek extract in terms of powder and formulation of capsule has shown promising results in improving the endurance of muscle and simultaneously can also be used for treating impotency. Diosgenin and diabetes. There are several reports suggesting that diosgenin-rich food sources such as fenugreek seeds and yam tubers contribute to anti-diabetic effect in experimental models. Evidence from human clinical trials clearly suggests that fenugreek seed improve blood glucose and other metabolic parameters leading to treatment of diabetes. Diosgenin significantly decreased plasma glucose in streptozotocin-induced diabetic rats by comparison to diabetic control, suggesting its anti-diabetic properties. These results were further strengthened by the fact that several hepatic rate limiting enzymes commonly involved in glucose metabolism altered in the diabetic state were normalized by the treatment with diosgenin. While there is ample evidence suggesting that fenugreek seeds may be used as an alternative medicine to treat diabetes and associate complication, more experimental studies are recommended to address if diosgenin can be efficaciously used to control diabetes and to understand the mechanism of action. Let's conclude, learners. The evidence thus far reported in the literature on diosgenin support the idea that this fenugreek component exert beneficial effect on several physiological markers relevant to metabolic syndrome. Diosgenin exert effect on pancreas, liver, skeletal muscle and adipose tissue that restore insulin sensitivity, glucose homeostasis and normal blood lipids in diabetic animals. By restoring pancreatic beta cells function and attenuating pancreatic and oxidative stress, diosgenin has shown to promote insulin secretion and preserve normal glucose concentration even in the presence of negative stimuli such as streptozotocin treatment or high fat diet. Furthermore, diosgenin can enhance insulin secretion. Learners, in our next module, we will be learning about the health benefits of fenugreek in detail.